first thing I'm gonna do is I'm gonna wash my hands. I'm gonna say, hi, my name is Allie. I'm gonna be your student nurse today. I'm gonna do a quick 5-minute head-to-toe assessment. Is that okay with you? Okay, perfect. I'm gonna check your name and your date of birth. Okay, can I get your name and your date of birth, please? And then I'll check it with the wristband. Perfect. I'm gonna assess your cognition. So do you know what month it is? Okay, do you know where you are? Okay, and do you know why you're in the hospital? Okay. The first thing that I'm gonna do is I'm gonna check your eyes. So I want you to look straight ahead. Do not look directly into the light. We're checking to make sure that the pupils are constricting, and then the pupils should be constricting. They're constricting from 4 millimeters to 2 millimeters. And then I'm going to recheck to make sure that both of them are constricting. I'll check them both. They both look good. I want you to follow my pen light. Perfect. And then pupils are round, equal, reactive, and they're accommodating to the light. So now I'm going to check your nares, make sure that the mucosa is pink and moist, and that looks good. I am now going to check your mouth. Can you say ah for me? Perfect. I'm checking for the uvula to vibrate. The teeth look white and straight. The throat looks good. The tongue looks good. Everything is pink, moist, and intact. The lips are pink and intact. I'm now going to just check your ears. I'm going to inspect them first. Make sure there's no unusual redness. I'm going to look inside the ear canal, make sure there's no unusual discharge. I'm going to press on your tragus and you tell me if you feel any pain. Okay? Now I'm going to do the other side. We're going to do the same thing. We're going to check for any redness, any unusual discharge, and tell me if you feel any pain when I touch your tragus. No? Okay, perfect. Have you had any issues with headaches, vision issues, swallowing, hearing issues, anything like that? No? Perfect. I'm now going to just check your skin turgor, make sure there's no tenting. I'll check around your clavicle area. Now I am going to remove this. Is that okay with you? Okay, perfect. I'll move this down so we can see the whole body. Okay, we're just going to check for the skin integrity, make sure that everything's okay, look for redness, bruising, swelling, everything seems to look good. So I'm now going to auscultate for the heart. I'm first going to do the aortic, which is the second intercostal space, the pulmonic, which is also second intercostal, which is left of the sternum, and then aortic would be right of the sternum. We're going to move down to Erb's point, which is left of the sternum, third intercostal, and then we'll go fourth intercostal, which is tricuspid, and then the fifth intercostal, which is the mitral, and that is midclavicular. Now we are going to listen to the lungs, which we are also going to do posteriorly too. So we'll start first intercostal, second, third, fourth, and then fifth, sixth on the sides. Okay, have you had any issues with shortness of breath, any chest pain, any breathing issues at all? No? Perfect. Now I'm just gonna look at your abdomen. I'm gonna remove this while trying to maintain some integrity here. Okay, we're gonna inspect your abdomen, make sure that there's no unusual swelling or distension. Everything looks good, there's no redness. So now I'm just gonna take a listen. We'll start in the right lower quadrant, right upper, then left lower. We're listening for 5 to 34 vowel sounds per minute. Now I'm just gonna palpate. Tell me if you feel any pain, any discomfort. I'm also palpating for any swelling or unusual feelings. Everything seems to be good. We're gonna start inspecting both of the arms. We're just gonna look, make sure there's no redness, no swelling, bruising, any lesions, everything looks good. I've already checked the skin turgor at the clavicle. I'm gonna do the capillary refill on each of the fingers. And they should be less than 3 seconds, which is perfect. Now I'm going to do the radial pulses. We're gonna do the rate, which is 70 beats per minute. The rhythm is normal, and the force is +2. So everything seems to be good there. And then for abdominal, I forgot to ask, have you had any issues with constipation, diarrhea, any urinary issues, any abdominal pain? No, perfect. And then I'm also going to just inspect your genitalia. I'm looking for any lesions, any abnormal discharge, any swelling, redness. Everything seems to look good. Now I'm going to check your lower extremities. Okay. And then I'm not sure if I asked, but have you had any problems with cough or shortness of breath, any breathing issues? Okay, no, perfect. We're gonna check the capillary refill of each of your toenails, which should be less than 3 seconds. And then we are going to check for edema. And then before checking for edema, we're gonna make sure to inspect, make sure that there's no bruising, redness, swelling, lesions. I'm going to check the dorsalis pedis pulse at the same time. The rate is 70, the rhythm is normal, and the force is +2. And then we'll check the posterior tibial. At the same time, the rate is 70, the rhythm is normal, and the force is +2. So everything seems to be good with the lower extremities. And then I want you to repeat the following after me. We're gonna do supination, pronation, flexion, extension, abduction, adduction, and circumduction. And then I have completed a full set of vitals on my patient. They are within normal ranges, and I have completed my physical assessment. And I'll put this back up for you. Is there anything else that you need before I go? No? Okay, perfect. Then I'd put your call light right here.